Hello, this is Avery Mendelson from the Department of Internal Medicine. I'm here to present a case report titled Toxoplasmosis Aseptic Meningitis in a patient taking Tofacitinib. This case report was developed in collaboration with the Department of Internal Medicine and the Department of Infectious Disease at Ascension Providence Hospital in Southfield, Michigan, in affiliation with Michigan State University College of Human Medicine. Introduction. Toxoplasmosis is an infection due to an intracellular parasite known as Toxoplasmosis gondii. More than 40 million people in the United States may be infected with this Toxoplasma parasite. Toxoplasmosis is considered one of the neglected parasitic infections of the United States, according to the CDC. Healthy individuals affected rarely have symptoms. However, pregnant women and immunocompromised individuals are at risk for symptomatic illness. According to the National Institutes of Health, autoimmune disease prevalence in the United States is rising. Fortunately, a proliferation of disease-modifying agents has transformed treatment guidelines of autoimmune disease. One such novel medication is Tofacitinib, a Xeljanz kinase inhibitor. In figures 1 and 2, you can see the mechanism of action of this medication. In figure 1 is the normal JAK-STAT signaling pathway. Cytokines bind to surface receptors and activate the JAK-STAT pathway, leading to intracellular gene expression. In the presence of Xeljanz, the Tofacitinib, this Janus kinase is inhibited, preventing intracellular activity. Patients that take these medications, like Tofacitinib and other disease-modifying therapies, can experience symptom improvement and have a slowed progression of their autoimmune disease. Despite the benefits, immune suppression increases their risk of serious infections. This case describes a likely infectious complication of this disease-modifying anti-rheumatic drug. Case report. Our patient is a 55-year-old female with a history of psoriatic arthritis taking Tofacitinib. On admission, the patient had a temperature of 102.4 degrees Fahrenheit, in addition to a severe headache, light sensitivity, and neck pain. A CT scan of the head was unremarkable, so in the emergency department a lumbar puncture was performed. The cerebral spinal fluid was found to be colorless. The protein and glucose levels were in the normal ranges, and there was no laboratory evidence of infection. Despite the unremarkable CSF, the patient had persistent symptoms and high fevers. Due to her medication-induced immunocompromised state, further evaluation for aseptic meningitis was ordered. The CSF cerebral spinal fluid was analyzed for viral etiologies. Enterovirus and HSV herpes simplex virus were found to be negative. Further analysis of the CSF for fungal etiologies was negative. Cryptococcus and histoplasmosis were not found. The patient did acknowledge a history of woodland camping, as well as having pet cats in the home. This additional history led to further laboratory evaluation. A Lyme serology was found to be unremarkable. However, Toxoplasmosis IgM was found to be elevated to greater than 4 IA, with the normal range being 0 to 0.8. And there was also a slight elevation of the Toxoplasmosis IgG to 10 international units per milliliter, with the normal range between 0 and 9. Given the findings and the concern for immunocompromise, the patient was tested for HIV and found to be negative. Case report continued. Given the patient's symptoms and immunocompromise, a decision was made with the support of the infectious disease department to treat the patient. The guideline therapy for toxoplasmosis, pyrimethamine, was not available, so trimethoprim sulfamethoxazole with weight-based dosing was initiated and the Tofacitinib was discontinued. Upon patient follow-up as an outpatient, she was found to have a further elevation in her Toxoplasma IgG to 55 international units per milliliter, and this is consistent with an acute toxoplasmosis infection. Discussion. The patient developed aseptic meningitis from toxoplasmosis. She had a clinically symptomatic illness and laboratory evidence of IgM and IgG for Toxoplasmosis gondii. The profound elevation of her IgG on follow-up confirmed the diagnosis. Her use of disease-modifying anti-rheumatic drug resulted in immunosuppression and a symptomatic illness that required treatment and discontinuation of her disease-modifying therapy. The medication Tofacitinib, also known as Xeljanz, has a documented black box warning illustrating the risk of serious infection. Conclusions. This case demonstrates the importance of maintaining a broad differential and understanding the risks of immunosuppressive medications. As more disease-modifying anti-rheumatic drugs gain approval, we must remain up to date on their appropriate use and their potential side effects. References are listed below. Thank you very much.